161. Myasthenia gravis can cause diplopia. True or false? Answer. True. Rationale. Myasthenia gravis weakens ocular muscles, causing diplopia, double vision, a common symptom, per clinical presentation. 162. All patients with epilepsy require lifelong anticonvulsant therapy. True or false? Answer. False. Rationale. Some epilepsy patients, especially those seizure-free for years, may discontinue anticonvulsants under medical supervision, per management guidelines. 163. The nurse should assess for photophobia in patients with migraines. True or false? Answer. True. Rationale. Photophobia, sensitivity to light, is a common migraine symptom requiring a quiet, dark environment, per nursing care standards. 164. Huntington's disease is diagnosed through a lumbar puncture. True or false? Answer. False. Rationale. Huntington's disease is diagnosed via genetic testing for the Huntington gene mutation, not lumbar puncture, per diagnostic criteria. 165. Increased intracranial pressure can cause a headache. True or false? Answer. True. Rationale. Increased intracranial pressure stretches meninges and blood vessels, causing headaches, often worse in the morning, per neurological signs. 166. The Romberg test is used to assess seizure activity. True or false? Answer. False. Rationale. The Romberg test assesses balance and proprioception, not seizure activity, which is evaluated with EEG, per neurological assessment tools. 167. A patient with a spinal cord injury should use a pressure-relieving mattress. True or false? Answer. True. Rationale. Pressure-relieving mattresses reduce pressure injury risk in spinal cord injury patients with impaired sensation, per wound care protocols. 168. Trigeminal neuralgia is caused by a spinal cord injury. True or false? Answer. False. Rationale. Trigeminal neuralgia is caused by irritation of cranial nerve V, often idiopathic or vascular, not spinal cord injury, per pathophysiology. 169. The nurse should teach fall prevention to patients with multiple sclerosis. True or false? Answer. True. Rationale. Multiple sclerosis causes ataxia and weakness, increasing fall risk, requiring education on assistive devices and safety, per nursing care plans. 170. Bell's palsy is treated with anticonvulsants. True or false? Answer. False. Rationale. Bell's palsy is treated with corticosteroids and antivirals, not anticonvulsants, which are used for seizures, per treatment guidelines. 171. The nurse should monitor for altered mental status in patients with traumatic brain injury. True or false? Answer. True. Rationale. Traumatic brain injury can cause altered mental status due to cerebral edema or hemorrhage, requiring frequent neurological checks, per neurotrauma protocols. 172. All strokes are caused by hypertension. True or false? Answer. False. Rationale. While hypertension is a major stroke risk factor, strokes can also be caused by emboli, atrial fibrillation, or other factors, per etiology. 173. Amyotrophic lateral sclerosis can cause muscle atrophy. True or false? Answer. True. Rationale. ALS causes lower motor neuron degeneration, leading to muscle atrophy and weakness, per clinical progression. 174. The nurse should administer sedatives to all patients with epilepsy. True or false? Answer. False. Rationale. Sedatives are not standard for epilepsy. Anticonvulsants are primary, with sedatives used only for specific complications, per management guidelines. 175. Meningitis can cause seizures. True or false? Answer. True. Rationale. Meningitis irritates the brain, lowering the seizure threshold, requiring anticonvulsant prophylaxis in some cases, per clinical complications. 176. Parkinson's disease is fully reversible with treatment. True or false? Answer. False. Rationale. Parkinson's disease is progressive. Treatments like levodopa manage symptoms but do not reverse the disease, per treatment guidelines. 177. The nurse should assess for dysphagia in patients with Parkinson's disease. True or false? Answer. True. Rationale. Parkinson's disease impairs pharyngeal muscles, causing dysphagia, increasing aspiration risk and requiring swallowing assessments per nursing care plans. 178. Peripheral neuropathy is diagnosed through a blood test. True or false? Answer: false rationale. Peripheral neuropathy is diagnosed via nerve conduction studies and clinical evaluation, though blood tests may identify causes like diabetes, per diagnostic criteria. 179. A patient with a stroke should receive aspirin within 24 hours of symptom onset. True or false? Answer: true rationale. Aspirin within 24 hours of ischemic stroke reduces recurrence risk, provided hemorrhage is ruled out, per American Stroke Association guidelines. 180. The mini-mental state examination is used to diagnose epilepsy. True or false? Answer: false rationale. The mini-mental state examination assesses cognitive function, not epilepsy, which is diagnosed with EEG, per diagnostic tools. 181. The nurse should monitor for constipation in patients with spinal cord injury. True or false? Answer: true rationale. Spinal cord injury impairs bowel motility, causing constipation, requiring bowel management programs, per nursing care standards. 182. All patients with multiple sclerosis experience vision loss. True or false? Answer: false rationale. Vision loss, e.g., optic neuritis, is common in multiple sclerosis but not universal, with symptoms varying by patient, per disease patterns. 183. Increased intracranial pressure can cause bradypnea. True or false? Answer: true rationale. Increased intracranial pressure affects the brainstem, causing bradypnea, slow breathing, part of Cushing's triad, per neurological emergency signs. 184. The nurse should restrain a patient with a traumatic brain injury to prevent agitation. True or false? Answer: false rationale. Restraints can increase agitation in traumatic brain injury patients. Non-pharmacologic de-escalation is preferred, per neurological nursing care. 185. Myasthenia gravis is diagnosed through a genetic test. True or false? Answer: false rationale. Myasthenia gravis is diagnosed via clinical evaluation, Tensilin test, or electromyography, not genetic testing, per diagnostic criteria. 186. The nurse should teach patients with migraines to maintain a regular sleep schedule. True or false? Answer: true rationale. Irregular sleep can trigger migraines, requiring education on consistent sleep patterns, per non-pharmacologic management guidelines. 187. Huntington's disease causes cognitive decline. True or false? Answer: true rationale. Huntington's disease affects the basal ganglia and cortex, causing cognitive decline, including memory and executive function deficits, per clinical progression. 188. All seizures are caused by epilepsy. True or false? Answer: false rationale. Seizures can be caused by epilepsy, but also by fever, head injury, or electrolyte imbalances, per seizure etiology. 189. The nurse should assess for nuchal rigidity in patients with stroke. True or false? Answer: false rationale. Nuchal rigidity is a sign of meningitis, not stroke, which presents with symptoms like hemiparesis or aphasia, per clinical assessment. 190. A patient with a spinal cord injury is at risk for urinary tract infections. True or false? Answer: true rationale. Spinal cord injury impairs bladder emptying, increasing urinary tract infection risk, requiring catheterization and hygiene, per nursing care standards. 191. The Babinski reflex is normal in adults with Parkinson's disease. True or false? Answer: false rationale. A positive Babinski reflex in adults indicates neurological dysfunction, not typical in Parkinson's, which affects basal ganglia, per assessment standards. 192. The nurse should monitor for weight loss in patients with ALS. True or false? Answer: true rationale. ALS causes muscle atrophy and swallowing difficulties, leading to weight loss, requiring nutritional support, per nursing care plans. 193. Trigeminal neuralgia is treated with beta blockers. True or false? Answer: false rationale. Trigeminal neuralgia is treated with anticonvulsants like carbamazepine, not beta blockers, which are used for hypertension, per treatment guidelines. 194. The nurse should assess for aphasia in patients with Alzheimer's disease. True or false? Answer: true. Rationale: Alzheimer's disease affects language areas, causing aphasia in later stages, requiring communication strategies per clinical progression. 195. Increased intracranial pressure can cause seizures. True or false? Answer: true. Rationale: increased intracranial pressure irritates brain tissue, lowering the seizure threshold, requiring anticonvulsant prophylaxis for neurological complications. 196. All patients with Bell's palsy require hospitalization. True or false? Answer: false. Rationale: Bell's palsy is typically managed outpatient with corticosteroids, not requiring hospitalization unless complications arise, per treatment guidelines. 197. The nurse should teach patients with epilepsy to avoid alcohol. True or false? Answer: true. Rationale: alcohol lowers the seizure threshold, increasing seizure risk, requiring patient education per epilepsy management guidelines. 198. Parkinson's disease causes muscle hypertrophy. True or false? Answer: false. Rationale: Parkinson's disease causes muscle rigidity and weakness, not hypertrophy, due to dopamine deficiency, per clinical presentation. 199. A patient with a stroke is at risk for depression. True or false? Answer: true. Rationale: stroke can affect mood-regulating brain areas, causing post-stroke depression, requiring screening and support per stroke care protocols. 200. The Glasgow Coma Scale assesses chronic neurological conditions. True or false? Answer: false. Rationale: the Glasgow Coma Scale assesses acute consciousness, not chronic conditions, which require cognitive or functional assessments per neurological tools.